This is just a quick reminder to advise you of what to expect following your lip treatment. You may find that following treatment your lips feel numb. This is really normal because in the filler there's an ingredient called lidocaine. This is a numbing agent which helps to make the treatment process more comfortable. So the numbing can last for around an hour after the treatment. You should find that it will wear off gradually. It's really normal to feel self-conscious about your lips, especially if it's the first time you've had them treated. They can feel a bit lumpy and bumpy, and you can just have a general awareness that there's something there. This time. Another common issue following lip injections is swelling. Swelling can vary from person to person and from treatment to treatment. It can be dependent on things like the amount of product used, the type of product used, and some other factors that we don't really understand. As a rough guide, I normally tell you that you can expect swelling immediately after treatment. That evening before you go to bed, you might look in the mirror and think they look even bigger. And again, when you get up in the morning, you might find that the swelling has increased again. This is really normal. Again, as a rough guide, I would say the swelling lasts for around 48 hours. For some people, it may be longer than that. Bruising is another issue that can happen with lip injections. Our lips are pink because there's lots of blood vessels there, and unfortunately that does mean that when we inject, the risk of bruising is a little higher than anywhere else in the face. If you're unlucky enough to get a bruise, that also will fade with time. A couple of tricks to try at home to help speed along the healing process include icing, and what I mean by that is take some ice out of the freezer, wrap it in something clean, hold it over your lips for around 2 minutes, and then put it back in the freezer and repeat that on an hourly basis. You can do that for about 48 hours. This will help reduce swelling. It will help with any bruising that might be brewing, and it also helps the product just to settle into your lips nicely. An antihistamine tablet or an allergy tablet can also help with swelling. You can buy those over the counter at the chemist or in some supermarkets. You can also take a tablet called arnica, which also comes in a cream and gel form. This you will find in health food shops, and whilst there is actually no medical evidence that it helps reduce bruising, I have many clients who do swear that it makes a difference, and my view on that is it's not going to do any harm. So if you have a bruise or you're particularly concerned about bruising, then feel free to use that. It's a good idea not to drink alcohol about 24 hours before your lip treatment and for 24 to 48 hours afterwards. Again, the reason is that alcohol will thin your blood and increase your risk of bruising. The lips will settle over the following weeks from your treatment and feel like they look much nicer, much more natural after a couple of weeks. How long the treatment result will last for is really dependent on the product that was used and the amount that was used. In terms of retreating, you can add more volume after 2 weeks from the original treatment, and really at any time interval that suits you. As always, if you have any questions following your treatment, please do not hesitate to get in touch with me. You can do that via the clinic directly, or if it's out of hours, please do feel free to email me on erimmer@lpa.london. That's ERIMMER@lpa.london. And as always, I will respond as quickly as I can. I really hope you enjoy the results of your treatment, and I look forward to seeing you again soon.